Hey everyone, let's talk about something super important in healthcare: infection control. This isn't just a buzzword, it's the backbone of patient safety. Imagine you're a patient in a hospital. Your immune system might be compromised, making you more prone to infections. Without proper infection control, you could end up with a hospital-acquired infection, or HAI. These infections can prolong your hospital stay, complicate your treatment, and in severe cases even lead to death. For example, a surgical patient might develop an infection at the incision site if sterile techniques aren't followed. Now let's talk about antibiotic resistance. It's a massive challenge today. Bacteria like MRSA and C. diff are becoming resistant to antibiotics. Effective infection control, proper hand hygiene, cleaning medical equipment, and smart antibiotic use prevents these bacteria from spreading. In an ICU, a MRSA-infected patient could easily spread bacteria if precautions like PPE and isolation aren't followed. Healthcare workers are on the front lines, exposed to infectious agents daily. Proper infection control protects them and their families. Think about the COVID-19 pandemic. Healthcare workers needed N95 masks, face shields, gloves, and other PPE to stay safe. Following infection control protocols like donning and doffing PPE correctly and disinfecting equipment was crucial. Infection control also helps reduce healthcare costs. HAIs lead to longer hospital stays and additional treatments, driving up costs. For example, a central line-associated bloodstream infection, CLABSI, can extend a patient's stay by weeks, costing tens of thousands of dollars. Proper techniques and hygiene practices can prevent these infections and save money. Maintaining a healthcare facility's reputation is another key aspect. High infection rates can damage a hospital's reputation. Patients want to go to facilities with proven safety records. A hospital reporting high rates of ventilator-associated pneumonia might lose accreditation or receive lower ratings, leading to fewer patients. Compliance with legal and regulatory standards is non-negotiable. Healthcare facilities must adhere to regulations set by the CDC, WHO, and other bodies. Non-compliance can result in penalties, loss of accreditation, and reduced funding. Regular audits, staff training, and hand hygiene campaigns are essential for compliance. Infection control is also crucial in preventing outbreaks and pandemics. Infections like influenza, norovirus, or tuberculosis can spread rapidly without strict measures. During the Ebola outbreak, stringent infection control practices, using specialized protective equipment, isolating patients, and proper waste disposal, were critical in controlling the virus's spread. So, what are the core components of infection control? Let's break it down. Hand hygiene. Frequent hand washing or using alcohol-based sanitizers is the most effective way to prevent infections. A nurse sanitizing their hands before and after touching a patient reduces pathogen transfer. Sterilization and disinfection. Medical equipment and surfaces must be regularly cleaned. Surgical instruments are sterilized after each use to eliminate microorganisms. Isolation procedures. Contagious patients are isolated to prevent spreading infections. A tuberculosis patient might be placed in a negative pressure room to control airflow. Use of personal protective equipment (PPE), gloves, gowns, masks, and face shields protect healthcare workers. During outbreaks, full-body protective suits prevent contact with infectious agents. Surveillance and monitoring infection control teams monitor infection rates and investigate outbreaks. An increase in post-surgical infections might prompt a review of sterilization procedures. Infection control in healthcare is a multifaceted practice essential for protecting patients, healthcare workers, and the community. It involves hygiene, protective measures, and regulatory compliance to reduce infection risks, control outbreaks, and maintain healthcare quality. Thanks for watching.